quick in which they adoption.
Because we have.
I concur.
Oh yeah, nobody wants to visit us.
Do we have the?
Of course.
Is Michelle coming?
They used to print the agendas. That again. I like the agenda for us. Awesome.
Yeah, you're right. That's Chris.
You're absolutely
To check off and follow. I know. I put it on my phone, but then I feel bad looking at my phone during, or it like blanks. I'm not actually texting. I am.
Plus, I like to take notes on it.
Yeah, I do too. I have a whole binder.
Beautiful. Thank you so much. I appreciate it. I got one.
At one time, I kind of on it. So I
There's nothing on this one. I'm talking about for the future.
now we're down to two. Like, I think I'll be a quarter horse donkey.
I hear those donkeys.
I'm okay. I told him I already know what's on it because I looked. Yes, they are.
The donkeys.
All right, it is 5:30.
But thank you. That's a dog.
That too. We're getting around them.
Oh shoot. The donkey doesn't know the difference between a horse and a coyote.
Good
Hi.
protection.
Are you guys ready?
Yeah.
All right, it's 5:30. You guys want to get started?
Yeah.
Start off with pledge. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. All right. I think we have a quorum, right? 4 of us. I guess I should ask the lawyer, right? Is it 4 of 4?
I was trying to think. It's 4 of 7.
Yeah, 4 of 7. I think we're good, right? So 1 quorum. Perfect. We got a quorum, so we can start this off. All right. Tonight, April 7th, we are gonna. Can I get a motion to approve the minutes from the March 3rd meeting by any chance?
Motion to approve minutes from March.
Beautiful. I guess that's it, right? I mean, they usually give us like the
Seconded.
Roll call.
the roll call for the 4 of us. No, it's okay. Darius.
Michelle Jerry is here? No. Okay, she's the only one, right? Okay. Sylvia Graham?
Here, yes.
Dr. Henry Front?
Yes.
Robin Lane?
Yes.
Do I see Chris?
And Chris O'Shea. Yes. Awesome. And then announcement. May 5th, Board of Health meeting has been canceled due to primary election day. Woo, can't believe that's around the corner. And then the next Board of Health meeting is going to be scheduled for June 2nd, if you guys want to put that on your calendars. All right. New business. I believe that you guys want to tell us about the Opioid Settlement Grant Award. I give you the floor. Matt.
Okay, so we applied for an opioid grant and we received it. We had 4 things on our proposal: recovery, sustaining fine health, pulse point integration, and state heart stations. I'm going to let Antonio and Jess talk about the peer recovery quick. You guys have already heard about fine health and about the pulse point integration. This is the one that we haven't done yet.
Hello.
Hello.
Good evening.
This is Antonio. He is a peer recovery coach. I covered for JDC Nursing maybe a year ago-ish. And so while I was out there, I recognized a lot of things that they needed help with. And unfortunately, I don't have any mental health training education that I could provide to them, but I know Antonio did. So what I did was, with the help of Chris, wrote a grant proposal to pay Antonio to go out, was it every other week, a month, and do 1 hour peer recovery and coaching for the kiddos in JDC. And I'll let Antonio tell you a little bit about himself. We did get the award, and he will be going out.
Yes. My name is Antonio Turner. I'm a little loud, sorry. And I've been the food safety inspector here for the past 4 years. And while working here, I've earned my Bachelor's of Science degree in Addictions Counseling, a certification in peer support and youth mental health. But most importantly, my lived experiences are what brought me here today. I've lost a lot of family members and friends from the health complications and consequences associated with substance abuse. When I see this new generation of youth offenders, I see a younger version of myself. I can relate to their trauma, their loneliness, their pain. They need someone who understands them, someone who can say, I get it. I know I may not be able to save the youth, but I'm confident I can make a change by planting positive seeds. So my objective is to address negative coping strategies, encourage positive coping and self-empowerment strategies. So let's remove the stigma that if you made a mistake, there's no hope for you. The youth is our future, and I'm happy for this opportunity. I'm ready.
Any questions?
So this grant we've received already.
Mm-hmm.
So there is the money for you to go and do this.
Yes, ma'am.
How long will that be?
For a year.
For a year.
For a year. So every other week for a year.
Yes.
And who identifies the youth group?
Oh, they're there. They're being home
So they're
at JDC.
okay. So they're incarcerated.
Yes, they are.
Yes.
Okay.
And it'll switch up
And
from time to time.
So
People will leave.
change all the time.
Yeah.
You'll be going providing service to the youth that are there.
Yes, ma'am.
Okay.
Yeah, I'm excited.
Wonderful.
Yeah.
So we go out monthly to provide, well, not just the health department, but a whole bunch of groups in the admin to do education once every month for an hour. So we're out there trying to do something, trying to do some good.
Awesome. And how do you think that it's gone so far?
The education?
Yeah, and just the interaction with the kids and just seeing how they're retaining things. Because I'm just curious.
So we did a stop the bleed, which was very well received. They loved that. Then we did a hands-only CPR, and some of them did not want to participate, and they don't have to if they don't. We have done STI testing out there for years, which is also goes with a class from our STD nurse, and so that class is always very well received, and then lots of good conversation and sketch conversation come from that, but it's worth it.
And recently, me and Carrie Batson, the food program director, we did a food presentation there, and they were interacting. They seemed to enjoy it. I mean, everybody eats, right? So
Hopefully.
Yeah, they were right. They were chiming in, asking questions. It went pretty well.
Exciting. And I'm really excited that a man's going in there and doing it because I think it's just a lot of those kids don't necessarily have a male role model in their life, and just to have somebody in their life that is able to make an impact.
I agree.
From that point of view, I think that's going to be really great, actually.
Yeah, because I think it not only destigmatizes the just mental health in general, but also seeking help. Because
Right.
sometimes when someone has gotten help from someone and participated, now they're more open to later on continuing to receive help, and then sort of spreading the word that seeking help is okay.
Yes.
Right?
Mm-hmm.
Glad that you're doing that. Thank you.
I am too. Very happy.
Yeah.
All right. Thank you, guys.
Thank you.
Thank you.
So the total award for the opioid grant was $27,590, but we're also getting an additional $20,000 from the commissioners.
Awesome.
Nice.
Oh,
The integration of Pulse Point to the 911 system, 2 80s and Save Our Stations, 1 at Sunset Hill Park and 1 at the Expo Center, and then the remaining portion of Main Health that we owe, which is like $500, because they received a small partial grant. It's great. It's awesome. Do you guys have any questions about any of that stuff? And there's the rest of the PowerPoint if you'd like to. If I got emailed to everybody else.
Absolutely.
Other than that, I think that's the rest of it. If no one has any questions.
So I know this is, you haven't prepped this, and I apologize for this, but it looks like you guys had a 70% growth from 2024 to 25. How's the website doing?
Come on down.
Come on. we're
expert.
We got a lot of time tonight, so
Yeah.
Oh boy, I should have brought. So I did kind of do a full presentation so that I could talk about it. So this was particularly focused for opioid funding.
Right.
And so it started in December of 23, but I used 24 and 25. So it's just based on users who are going to the website and searching, and then key searches. Sam Burgett, and we've added Ellen from the sheriff's office now as part of the admin team. We are meeting with our customer service manager every other week, and then Sam, Ellen, and I are meeting the opposite weeks. We are promoting it, so we have window clings now or removable stickers to put on the outside of businesses, and it's just continuing to grow from word of mouth. I was doing some peer support training myself a couple weeks ago, and we had individuals from Lake County and even South Bend. They took the Find Help magnet. So I'm also promoting that you can use it anywhere. You don't have to be here in Porter County. So I think that's pretty good. And then I talk about, you search by zip code, you search by keyword. We've got our front page that has veterans, recovery, reentry, 24/7 crisis services, so they have one click to get to those services if they're in crisis because they're not thinking. The autism elopement kits that we offer, we recently adjusted and added autism community to the community connection. And Jesse, who's our VU intern, added 30 to 40 organizations on there. So we're promoting it that way. We're letting the Lake County Health Department know. So it's just that outreach, the continuous effort to getting programs added, and we hope it continues to grow.
Yeah, I'm glad to hear the crisis, like the one click, especially in reviewing the data from the number of suicides this month, that 4, right, in a month.
Yeah.
And just super concerning, right, that as we're seeing, more just general stress in the community, just hoping that, people are going to be either 911, 988, or clicking on Find Help. As much as we can get that access to quick help, the better.
Sure, and that was the whole thinking. We had only a few, and then we, I can't take credit, Sam and Ellen working at the sheriff's, they're like, if someone may have been raped or have domestic abuse, they are not going to be thinking clearly to put in a zip code to navigate. So we identify those resources that go into those front page shortcuts. And then we're always just sharing with the community resource network that meets once a month, share any organizations that need to be added. I recently met with the executive director of Respite House and Kathy's Hope, realizing one of their programs wasn't added, and they are for sober living. So it's just really kind of meeting our community where they are, but also the organizations that are providing the services. And I have more data I can send.
No,
PowerPoint.
It was more just I saw the 70% growth. So I was just kind of curious on that. Is there any way we can get some window cleans next time we come in?
Sure.
Oh, perfect.
I have them. I can run down and grab some and bring them up.
Yeah.
And if you want to put them, super excited that Tim Stites, one of our fire department individuals, he's going to be putting them on our fire trucks on the outside. He's going to be he's great, on the inside. So even if they're just sitting and talking to someone, ambulance, they're going to have it in there, and he's going to direct it. He's responsible for getting it on our city building in Valpo, on the city website. So we've got some really good partners with Community Resource Network. Center Township trustee, I give her the most magnets out of anybody. So, yeah, it's great.
I'll definitely put them up in my location.
Sure. And I always say a restroom, a public restroom right on the mirror is a good place, because if you're washing your hands, that's something kind of clever. VU, I think I gave them 20. So
beautiful.
So yeah, I'll go grab some so I can get you some after.
Perfect. Thank you.
All right. Anything else?
Thank you.
Jeff recognized there was the suicide numbers.
Oh, okay. Because I was third.
Yeah, and
with 4.
Set up a meeting with IDOH.
Okay. Thank you.
On Thursday, we already have the prevention task force.
Yeah.
And we're getting 988 out and all,
Yes.
all of that. But So I'm meeting with the state relief trauma injury prevention on Thursday along with Jamie to see if we can brainstorm come up with something else because this is just not working.
Okay.
We have a really, really high suicide rate.
That I was just astounded when I saw the number.
And its ages vary, like
Yes.
very old to very young.
Mm-hmm.
It's all
Okay.
in different ways.
Yeah.
All right. Good.
And then pulse point integration and safe heart stations if you have any questions about any of that stuff.
Legal, well, I don't want to cut off. We've reviewed some of the pulse point document, integration documents, and the basic contract is part of working with Matt. We did that on an expedited basis. I got this to be able to do that today, and we did go through it. And it's got the type of things that we're trying to get out, including our notices to be able to terminate a contract, and that we can get out of it if there was an issue. We actually don't anticipate from this particular provider that there's going to be any kind of issue, but it does have that language, so we would approve this from legal as it is now.
Yeah, one of the things is that we've kind of just been waiting for the funding. So now that we have it, we're as quickly as possible to get the SIP grant and 911. So they've already started talking. They got the application and the paperwork sent to us today, so we can get signed and get moving on that. It's a long process. It should take about 3 months to get everything integrated and moving. So
Do we need to vote on this?
I don't think we do. It's through our state Porter County.
Okay.
We're just holding the funding. And then the safe heart stations were the other thing that we did. And we will end up having 2 at Porter County Expo, 24/7 AED stations, one on either end, since depending on what's going on is kind of where you would need it. And we thought about putting one at the grandstand, but we decided that with them, anytime the grandstand front, they have a police officer out there who happens to have an AED with them. So it would be overkill. So that's why we decided. And then we have a plaque government is working together to make this happen. So, and if you have any questions, Crystal and I can hopefully answer all of them.
Cool. I'm just flabbergasted. It's awesome. All right. Anything else on that one? All right. No old business today. Any reports from the board attorney?
We do. I will continue with us meeting as quickly as we can through the this week. But we have. That's why I tried to interject my power that I approved those contracts during the new business portion of it. We have some additional. That's what I'm going with. We had some additional subpoenas and FOIA requests. We take care of the subpoenas if that means that they're directly through an active litigation, and so we don't even need to acknowledge that. The legal department will take care of that and respond to it. We still have to actually go to the health department to get the actual materials, but then we respond to the subpoenas if they come from other lawyers. Well, I guess you could do that pro se as well, so it doesn't have to be the lawyers. And then the FOIA requests, we just acknowledge those. We typically have the lawyer actually acknowledge those, and then the health department can, if they have the materials easily accessible, and respond to those directly. And if we did some amount of training with our health department to make sure that we do that with Dave earlier and me to go over what the process is for FOIA, because it's a good reminder for people on how to go about doing it. We get a couple of those. At least that's my experience. That could be completely abnormal, but that's my understanding. So we went through that. We have a couple of different ordinances that we're going to take up from the from the staff on for the that are on different kind of feeds. That's coming up soon. This is the tattoo and changes to those fee ordinances.
Right.
That will be a process that we want to make sure that the commissioners are involved in, and the commissioner's attorney has a special format that they want to have for those ordinances. So we draft the ordinances; they're already drafted at this point for you to be able to take a look at them. There's a analysis that we have to do, and we really have to present to the commissioners on doing that. So at the June meeting, I've talked to Matt; he's going to be presenting that. And in the interim, we'll talk to the commissioners and Matt, and then McClure, the attorney for the commissioners, to make sure we're in the correct format. So I anticipate for the June meeting. We didn't want to rush it to get it for tonight, so that's why you're not seeing those for tonight for any recommendations. And there's no reason for us to do it. We want to make sure everybody's on the same page. It's over. You want that to be something that we're not contemplating or feeling like anybody's not getting a fair chance to be heard on. And that's all I have. That was as quick as I could make it. I have some stories if you'd like.
Well, fair enough. No, I appreciate it. The lawyer lingo is above my pay grade, so I'll defer to the people that know how to read those documents. I hope your colleague recovers quickly. Claims and receipts, I think we signed it. Anything else that we need to do with that?
I think Sherry just needs to say.
I'm sorry.
Michelle?
Yeah, Michelle. Okay.
Everyone. I'm like, her name.
Good. And then health staff officer.
I have one thing. We have family medicine residents from the Northwest Health Family Medicine Residency Program who rotate through the department almost on a monthly basis, I guess. And they've been doing that since I started. But they come through and they do an elective in public health. And so they go through all the departments. They'll go on like a food inspection. They sit with the nurses. They talk to vital records. They talk to environmental. They go out with environmental and things. But then they meet with me and I talk to them about public health and clue them into why things are done, what we offer, and usually it's kind of enlightening. They're like, "Oh, we didn't know you did this or that." So it's good education for people who are taking care of Porter County residents. But what I'm getting at is we also expanded our relationship recently. We met with the program and interim program director, who is now the program director, asking for their help. So one of the things that kept coming up was the TB patients that we would get. It's easy to send them to Dr. Young for treatment and further evaluation and whatnot, but a lot of these people don't have primary care. And so now we have a working relationship with the residency program where if they don't have a primary care physician, they will be directly funneled into the residency program, and the residents will take them on as their primary care patients while Dr. Young's treating on the side, but then they're taking care of all the other social issues and health issues they may have. So that was kind of a breakthrough moment. And it's good to get people plugged in. So
Good. I'm actually very excited that that's going on.
And we thought they were great learning cases for these young doctors too. I mean, I can say from personal experience, I did not ever see a TB patient when I was in residency, and actively treat them or treat alongside the ID doctor, like in primary care clinic. So, they were enthusiastic too. They were like, "Yes, these are excellent learning cases." So, yeah,
Cool.
Yeah.
I don't know who's the new program director.
Her first name is Kelly.
Kelly.
Dr. Kelly, and then the last name.
I'm going to call her Kelly.
Yeah.
Last name is very long. It starts with an M.
Okay.
But
Marsdeck.
But she took over. She sent an email out last week and just asking if we would still participate and seeing the residents come through on their elective and stuff. I think she sent it out to all the programs that they coordinate with, but we just said yes.
That's a genius idea that they get you guys to come. I never had a health board or health department exposure when I was in residency, so that's kind of nice that they have that exposure.
Yep.
So, okay, cool. May the force be with you and them. Any other issues report?
Well, Colby brought up the fact that we're going to be talking about fees and our remote tattoo ordinance at the next meeting. We'll also be talking about budgets. So, wanted to make sure everybody.
Crazy.
So,
And it's like it comes faster than you think. Like, how is it already budget?
we get
All right.
a month off, so we have a little meeting.
Prep yourself for June.
Just wanted to clue everybody in.
Okay.
Do we have to approve the claims and receipts?
Oh yeah. Good point.
Now that we signed them all.
It was.
I did, since Michelle signed it.
All right. Can I get a motion to approve the claims?
I move to approve.
Second.
Roll call.
Roll call.
Michelle,
Yes.
Sylvia,
Yes.
Dr. Brett,
Yes.
Raleigh,
Yes.
Dr. Osan.
Yes. All right. I think that's pretty much it. If you guys are wrapped up, today was a short meeting, but I guess as you guys said, next time we're going to be bearing down for a longer meeting, so we'll be ready for that. Any other comments or issues before we adjourn tonight? Public comments by any chance? All right. Can I get a motion to adjourn?
Move.
Second.
Yeah.
That was easy.
That's